Welcome to My Ecos 360. Connect, protect, and grow.
You might have seen the headlines about major insurers, specifically Humana, discussing targeted Medicare Advantage plan exits for 2027. Let's be clear about what that actually means. A plan non-renewal does not mean the Medicare Advantage program itself is ending, and it doesn't mean every plan from a specific insurance company is leaving the market. During a recent earnings call, Humana projected that its targeted exits will affect approximately 600,000 members. That is an aggregate estimate of affected individuals, not a list of terminated plans. National projections like that cannot tell us which specific beneficiaries or which individual counties will see their plans change. The exact details for next year aren't available yet. The Centers for Medicare and Medicaid Services, or CMS, expects to release the finalized 2027 Medicare Advantage and Part D landscape in mid to late September. That means you should ignore the social media rumors. Making a coverage decision right now, based on early headlines or somebody else's plan, is a mistake. National news should not trigger you to act. The only information that actually matters is the official, localized mail sent directly to you. If you currently have a Medicare Advantage plan, there are two distinct types of notices you need to watch for this September and October. The first is the Annual Notice of Change, or ANOC, which you must generally receive by September 30. Receiving an ANOC legally means your current plan is continuing into the new year, even though specific terms, networks, or costs might adjust. If your plan is officially terminating on December 31, CMS requires the insurer to send you a completely different document, a non-renewal notice. This scorecard shows the difference. On the left is the ANOC for continuing plans. On the right is the non-renewal notice. For plans ending December 31, federal regulations generally require this non-renewal notice to be dated October 2. The non-renewal notice explicitly outlines the exact date your plan ends, the applicable enrollment periods you now have, and your available alternatives for Medicare coverage. It will also contain rules for any Medigap guaranteed issue rights. If you receive this non-renewal notice, keep it. You may need it later to document your eligibility for those federal enrollment protections. Finding an October 2 non-renewal notice in your mailbox requires you to take action, but it also grants you specific federally protected choices for your next step. Let's assume you have received an official non-renewal notice. You now have to make an active choice. If you take zero action before your existing plan terminates on December 31, you lose your current structure. Inaction generally results in you being auto-enrolled into Original Medicare without any supplemental policy or prescription drug coverage. Relying on Original Medicare by itself exposes you to uncapped out-of-pocket costs for Part A and Part B medical services, along with potential financial penalties for lacking a Part D drug plan. To avoid that exposure, your first active alternative is to select a different Medicare Advantage plan available in your county. A new Advantage plan maintains the familiar all-in-one structure. Most include Part D prescription drug coverage and offer supplemental benefits that Original Medicare doesn't cover, like certain dental or vision care. However, assuming two plans from the same insurance company are interchangeable is a serious risk. Selecting a new Advantage plan requires you to meticulously verify that your specific doctors, your chosen pharmacies, and your current prescriptions are covered in the new plan's specific network. Remaining in Medicare Advantage offers convenience and bundled benefits, but it demands rigorous, localized network verification to prevent losing access to your specific providers. Your second active alternative is returning to Original Medicare and utilizing a Medigap policy. When a Medicare Advantage plan leaves your market or service area, it can trigger a specific federal protection called a guaranteed issue right. This matrix compares your two active paths. On the left is the bundled approach of a new Advantage plan. On the right is the modular approach of Original Medicare paired with Medigap. The primary power of the guaranteed issue right is that insurers cannot use your health history to deny you a protected Medigap policy or inflate your premiums because of pre-existing conditions. The financial trade-off of this path is the premium structure. You will generally pay higher upfront monthly premiums in exchange for strictly capped, predictable limits on your out-of-pocket medical costs. There is also an administrative trade-off. Because Medigap policies do not cover medications, you must proactively purchase a standalone Part D prescription drug plan. There is a critical exception regarding income and state assistance. Beneficiaries who are dually enrolled in Medicare and Medicaid face different legal restrictions. Selling a Medigap policy to a Medicaid enrollee is generally prohibited. Dual-eligible beneficiaries require specialized, state-specific advice rather than applying a general Medigap rule. The guaranteed issue path provides unparalleled provider freedom and financial predictability, but it requires you to manage multiple moving parts and generally pay a higher monthly premium. Both of these coverage paths are governed by strict timing rules. Because there are multiple overlapping Medicare calendars, navigating them requires attention to detail. This timeline shows the distinct deadlines you must track if your plan is non-renewing. The top bar is the standard annual enrollment period. Running from October 15th through December 7th, it serves as the primary window for most routine changes. The middle bar represents the Medicare special enrollment period granted specifically for plan non-renewals. This extends your opportunity to switch plans from December 8th through the last day of February. The floating bracket is the rigid Medigap guaranteed issue window. You can begin applying before your current plan ends, but this window generally slams shut 63 days after your coverage terminates. Relying solely on the extended special enrollment period timeline creates an operational danger. The effective date of your new coverage depends exactly on when you make your election. Choices delayed past December could result in a January gap in your coverage. While the special enrollment period provides a legal safety net, executing your choices early ensures you have seamless, coordinated coverage beginning precisely on January 1st. Your next step should strictly align with your personal healthcare priorities and your risk tolerance. This flowchart illustrates a systematic way to determine your path if you receive an October 2 non-renewal notice. Following the left branch, if you prioritize lower upfront premiums and bundled convenience, your action item is to thoroughly shop the 2027 Medicare Advantage plans in your specific county. Choosing this path means you knowingly forfeit the rare Medigap guaranteed issue window. Following the right branch, if you prioritize nationwide provider flexibility and predictable out-of-pocket caps, your action item is pivoting to original Medicare. This path requires you to execute a three-part move: claiming original Medicare, securing a guaranteed issue Medigap policy, and purchasing a standalone Part D plan, all within that 63-day window. There is no inherently better Medicare model. The correct choice is dictated solely by whether you value bundled convenience or modular predictability. You must never be pressured into an Advantage plan simply because it's a bundled package, or into a Medigap policy simply because you have a looming deadline. Review your specific doctors, your necessary medications, and your anticipated travel needs against any coverage you are considering. To find authoritative information for your county, consult Medicare.gov, the 1-800-Medicare hotline, or your State Health Insurance Assistance Program, commonly called SHIP. Utilizing state resources or properly licensed professionals is vital because individual state laws can offer additional Medigap protections beyond the federal baseline. A Medicare Advantage plan non-renewal is a highly regulated event. When navigated with official notices and clear deadlines, it empowers you to optimize your coverage for 2027.
Thank you for learning with My Ecos 360.